Hi, everyone. Welcome. I'm sorry we're running a few seconds behind here. Welcome to this episode of the live stream show, MyDiabetesHQ. Hello, everyone, diabetes warriors, champions, advocates, and cheerleaders. Today, I have with me an excellent panel of experts who will dive into access for care during times of COVID with diabetes. Today, first, we have Dr. Caracostis. She is a Chief Executive Officer of the Asian American Health Coalition and the Hope Clinic here in Houston. And she's going to talk to us about FQHCs and how we access healthcare. Additionally, we will have Serena Valentine. Hi, Dr. Caracostis. Additionally, we have Serena Valentine, CEO of Core Initiatives, a nonprofit health and wellness organization, and she runs our Houston Diabetes peer support groups. We also have Maryanne Strobel, registered nurse and certified diabetes care and education specialist. She works with inpatients and helping people manage and navigate their self-care for diabetes. So let's begin with Dr. Caracostis. So I want you to tell us about the wonderful things that Hope Clinic does. But first, I want to delve into perhaps if you can share with us what a federally qualified health center is.
Good morning, everybody, and thank you for being here early Saturday morning and taking a little time to learn about community health centers and Hope Clinic. Community health centers are federally qualified health centers. Is a designation that community health centers get from the Bureau of Primary Health Care, the health department, and they really portray a high quality of care and ease of access for vulnerable populations, low income people with limited health insurance, really with the goal of providing access to everybody, regardless of their ability to pay, not just access to care, but actually access to high quality services. I have a little PowerPoint presentation that I prepared for all of you so you can understand what community health centers are, and I will go through that really quickly without making you too dizzy and too bored. So if we can put up the presentation, Joy?
Okay, I'll go ahead and do that for you here. And there we go.
So I fell in love with this community health center model. Next slide. Many years ago, actually 20 years ago, when I started my career, because it is so equanimous. Healthcare is a great equalizer in our lives, and these community health centers were created again as a model of care in the war against poverty in the 1960s. And there are, I like to think about community health centers as the backbone of the healthcare system in America. There are over, in the next slide, please. There are over 1,300 sites
Oops. All right. I think we might. Are you muted again?
Oh, I muted myself again by accident. So where did I stop?
You stopped at describing the quantity of FQHCs. So let me
Okay, so
share my screen again for you.
yeah, so there are about 1,300 community health centers around the country, and we certainly deliver about care to 28 million people around the country. So we really are the backbone of healthcare in our country, and Hope Clinic is one of those community health centers, and we are, next slide. And we are located in Houston, and something very unique about this community health centers and Hope Clinic is that, first of all, we are community-based. That means that 51% of our board members are actually patients of our clinics, and that really, really is important because it is the community who drives those services and who shapes who we are. Another very important thing is that we are mandated to provide care to the full community, meaning if the community speaks different languages, then we need to tailor our services to that community. In the case of Hope Clinic, our community speaks over 65 different languages, and Hope Clinic provides care in 25 of those languages. Our staff is very, very multicultural, multilingual, and of course, we pride ourselves on providing really high quality of care. Next slide. So this is a picture of the mighty women who lead Hope Clinic, and a representation of how much empowerment we feel on what we can do for our community. Next slide. Next slide, please. I want to point out a little bit about, this is our staff in 2009. Hope Clinic opened its doors in 2002 as a all volunteer clinic with open half a day a month. In 2008, we became a lookalike. This is my staff in 2009, and this is my staff in 2017. You can see the enormous growth. Today, 2020, we are about 200 staff, and we don't fit in the picture anymore. And so this is the last group picture we have. We have 4 sites. We deliver our own babies, about 2,000 babies every year. And we also have a robust diabetes program. Next slide. So this is a little pictorial of our diversity, and you can see that we serve a large Asian community, but the Asian community is very diverse between the Burmese and the Vietnamese, Chinese. We also have a large African American community, largely African. And the next slide is a pictorial of our growth, and you can see that we have grown at a rate of about 20% year after year, and we're reaching a plateau. This is a description of our diabetes program, and I know we're going to get deeper into this, but I wanted to just say a couple of words about our diabetes program. First, about 10% of our patients suffer from diabetes, and we have a unique approach to diabetes in terms of, next slide, it really is very patient-centered. So next slide, please, and then I'll go back here. So this next slide, it shows a little bit, how we try to approach our systems change in diabetes and all the other health disparities that our communities provide. Really looking at addressing the healthcare not just as a point of care in a physician-driven, but also as a team. We really put the patient at the center of our care, and have an interactive team dealing with them. And we also go beyond our walls now in trying to address the upstream needs of our community. Next slide. Okay, you can see from this slide that the patient, this slide shows us one of our big programs newly created as an effort to really address upstream management of diabetes in our community. And it is not your traditional program where you do a lot of education on one-to-one to a patient. It's actually trying to change this philosophy of eating in a community by educating those who restaurant owners and potential chefs and restaurateurs who are interested, and who would teaching them about the power they have in their own hands to change the way our communities eat. If we can get the next slide, please. Okay, and I think that's the last of our slides, and I don't want to bore people with too many words. So Joyce, you can take the lead.
Yeah. So thank you so much for sort of giving us a wraparound understanding of what an FQHC is. I think that one of the things that is really great about it is that your clinic, Hope Clinic, and clinics like Hope Clinic provide care along two main guiding principles. The first of which is to provide care for individuals regardless of their ability to pay, and then also to be governed by community and by the patients. I think that both Serena and Maryanne have some comments regarding this, because I think that a lot of times people feel like they're going to a clinic and there's so many other factors that drive their diabetes management and control that, you know, they're looking for somewhere that gives them that wraparound care, right? So I think maybe Serena, Maryanne, do you guys want to discuss how your patient experiences would lend themselves to even greater sort of care if you were to, you know, utilize these types of clinics, if you were to share with your patients, your peers about that?
Yeah, sure, I will. When doing the peer support program, people come to me a lot, and they give an example of why they can't, you know, treat themselves or manage their diabetes well. And so the biggest thing is either I don't have health care, or I don't have health insurance. I'm sorry. I don't have health insurance. I don't have the money to go. I don't have a regular doctor to see. So it's really a big thing for us to be able to refer these people to these community health centers, because also what Dr. Caracostis mentioned about the language, there's a barrier also in Houston, Texas, because we're so diverse. We're like a melting pot of people. So being able to go somewhere where someone can speak your language or someone can identify with you culturally is very important. So I believe this is something that's really good for Houston to have. And I'm generally able to refer anyone to any one of these community health centers, because not everybody has the money or has the insurance to go and seek medical attention. And with diabetes management, that is a very big, important part of managing it effectively.
Yes, excellent. Maryanne, can you add to that?
Oh, yes, I can. So coming from an inpatient side, I deal often with patients who are newly diagnosed with diabetes. They're very afraid. They're learning this for the first time in the hospital, and now they're thinking, well, what am I going to do once I'm discharged? And just as Serena said, you know, a big question for them, a big concern is if they don't have current health insurance, you know, what are they going to do? So I think one important thing that Dr. Caracostis pointed out is that it's not only a cost of affordable or, accessible for everybody, but also that they're going to get quality care. And I think that's so important, because they're really looking at the patients in a 360 view. And we know, just as Serena said, that, you know, patients have these concerns regarding their culture, regarding their language, and being able to go to a place like the Hope Clinic is so comforting when we talk to patients about that before they're discharged.
Mm-hmm. Agreed, definitely. And so, Dr. Caracostis, so once you get to the clinic, right, you have access to these cares. Can you just maybe just highlight some of the things? Because I know one, you know, sometimes we say access and we don't really compartmentalize access in terms of how do I get there? How do I sign up? Is there someone, maybe I don't have a vehicle to access there. Can you just share some of those sort of logistical aspects of access that the Hope Clinic assists patients with?
Certainly. Hope Clinic it is not unique in what we do. We charge on the sliding fee scale. So we start with a nominal fee of $35, and then we go up depending on your income and family size. That way we help families share the burden of costs. We take all the insurances, Medicare, Medicaid, private insurances, Obamacare. And the one thing we do is as soon as a patient comes in, they can sign up online to have an appointment. They can call us, they can walk in. We do an eligibility process, not just to know how much we're going to charge them, but actually to help families apply for other types of health insurance. So if they are eligible for Medicaid, we will help them fill out the applications for Medicaid. If they are eligible for one of the Obamacare plans, we will do so as well. So it's really important that the eligibility process is actually really important in our place to understand what are the needs of the patient and prepare them for the future. Because while they have access to primary care and basic care at our clinic, God forbid they need to be hospitalized, and that is a service that we don't provide, and it is very costly. So we want to make sure that they are covered and prepared for that. The other aspect of care, of course, is that we take ownership of the patient, and we will assess not just their pap smear or their diabetes, but all the other factors that they have going on in their lives. For example, the stressors and the behavioral, emotional state, in other their immunization status and their living conditions, and access to fresh food. And we will work with the patient to address all those surrounding needs and try to understand where does the patient come from and what are their barriers to improving their healthcare status. We firmly believe that the best way for us to survive as an organization is to have healthy patients. So the healthier our patients are, the more robust and successful the clinic will be.
Excellent. So there was a question coming over from our MyDiabetesHQ Facebook, and I think that as you were speaking, I thought there's a series of questions that are coming over, regarding supplements for lowering your glucose. In addition, questions like, sometimes I don't eat and my glucose level is still high. Why? And these are the types of things that need wraparound clinic care, right? So you may have a visit to the pharmacy, which federally qualified healthcare or health clinics have in their community clinics. You may have access to, you will have access to a diabetes educator, a nurse. All of these questions may not be able to be answered in one specific visit with one member of the clinical team. But usually, if you get these questions and you have access to the individuals who can help guide you personally about these questions and how the different factors in your specific body impact these things, I think that, that really helps for someone to be able to target their complete management. Wouldn't you all agree?
Yeah, oh, yes, definitely.
Yeah.
Good points.
Mm-hmm.
So let's see here. Oh, go ahead.
So certainly, from the clinical point of view, we really, try to understand what are the barriers of the patient. Access to pharmacy. We work with patient assistance programs. We help them access our 340B program and lower prices. Our labs are largely subsidized, so the labs are at a lower cost. We really work hard for our diabetic patients. We have, group visits and nutritionists. However, we also rely a lot on our partners. So we do work with other people in the community to provide those services because we cannot operate as a silo. Diabetes in particular is a community-wide responsibility, and partnerships and supporting each other. And I think that Changing Cities Diabetes has done a fantastic job at helping people network and get in the spirit of how are we going to solve or reduce the burden of disease in our community. And I think that's very, very valuable.
Excellent. So let's see, we have a question for you, Dr. Caracostis. Let me see here. Can you speak to the importance of seeking care if you're a patient with diabetes during COVID? So why should?
Well, the unfortunately, or healthcare doesn't go away. So at the clinic, we saw a reduction of visits for a little bit, a couple, maybe 2-3 weeks, when at the peak of this pandemic. However, you still need to manage your disease. And I think it's most important to manage diabetes now during COVID, because it's such a stressful time, and stress is a trigger for affects your sugar level. And we have for a long time now done televisits, and so you can certainly access, if you're a patient of Hope Clinic, or if you're a new patient, you can schedule an appointment online, and you can have a televisit with your physician. We are in the process of developing some online networking, so that we can continue doing the group visits, but now in a digital format rather than in person. And if you come to the clinic and you need some labs, we have a process now by which you don't have to wait so much. However, we ask you to wear a mask, and we do take your temperature as you come in the clinic. But for your convenience, again, you can do a televisit and just come to the clinic for the labs. I encourage everybody to not delay their care. I know it's scary especially to go out to a clinic, but it's really important that it's better to be preventive than to be reactive.
Yeah, and I think one of the things in some of the fear that's surrounding, going in for your visit, is thinking that, that the exposure risk and things like that. I think we have to remember that clinics have put into place social distancing. They're providing you with masks. They're screening individuals. Clinic visits have been lengthened, at least I know in our clinics, or spread apart a little bit more. So there aren't so many patients on the schedule, so that you come in, check in, go back. Everything's been sort of streamlined, so there's really no reason to delay your care. One of the questions that is coming through from Reva on Facebook says, during these times of COVID, and it's along the same line, should a person with diabetes be worried about, and I think we can include this in regular outpatient care, as well as hospital admissions. And I think Dr. Caracostis can speak to what ways you can maybe bring your family in, sort of technology-wise, maybe using FaceTime or Skype or something like that during a visit. And then Maryanne, just kind of talk about those uses of technology, perhaps in the inpatient space.
Well, I'll go and just tell them a little bit about during hospitalization. So what we've done is, I've often, even in times of not COVID, if patients had family members that maybe live very far away, they've often asked, when I come in to do some teaching, if they could record me. And I absolutely don't have a problem with that. And, they have found that was very helpful. Maybe their family member had to go to work. They couldn't even call in when I was teaching, so they would put me on recording. Of course, if the family member is available, they, will put me on speakerphone. And so I'll talk to people remotely like that. And I've been on the FaceTime as well. So those are just some of the things that not only were implemented during COVID, but we can do those in non-COVID times as well.
Excellent. That's great, because a lot of people don't know. And of course, you still want to ask your physician, ask your hospital staff, your nurses, and then and see if you can actually, a lot of places may not let you record, but they may actually let you real time discuss with your family members.
That's a good point.
Yeah, Dr. Caracostis, is this the same in your clinics?
Yeah, absolutely. You know, we are limiting the number of people that can come in with a patient, and and we have always worked with digital technology, so people can call the translator, can call their families and consult with them. We are doing a lot of telemedicine, especially for the behavioral emotional part of the patient that is a longer visit. And so people can do this face chat that's part of our electronic health record. So everything gets recorded, and you can conduct a visit that way so you won't miss a beat. But not everybody is comfortable with technology, and it is a challenge sometimes when patients don't have appropriate equipment, or their Wi-Fi is not good enough, or they run out of minutes to talk with the doctor. So there's a lot of work that the community still needs to advocate about. It's not just the healthcare provider having the best equipment, it's also access for our communities in having good Wi-Fi and internet and devices that can work properly. So I encourage everybody to think about those things, to lift up their voice their concerns about how technology is now changing healthcare and this pandemic is shaping the way we will be moving forward in the technology utilization.
Yeah, it definitely is. And I think that the use of, the reminder that technology is also not accessible to everyone is an important one. Serena has created some resource page information that we'll link at the very end of this broadcast. So we'll put it up, have it up for some time. You can screenshot it. Remember, viewers, if you want to take a look at it, share it. But I think, Serena, talk about some of the more tangible resources that people have, say if they don't have access to a cell phone or a computer or things like that can help them to access care.
Okay. For example, we have the Dawn Center. Okay, the Dawn Center is the Diabetes Awareness and Wellness Network Center. It's an extension of the Houston Health Department. And I myself have actually participated in the program at Dawn Center, and it's fantastic, y'all. It's like you get to go there, you get to after you fill out your application, everything that they have there is for free. You have access to a nurse who will check your A1C for you, your cholesterol, blood pressure, all of that. You also have access to a nutritionist and a personal trainer. Who gets a free personal trainer, guys? I'm sorry, this is not a commercial for Dawn Center, but it is wonderful. I love it. Okay, yeah. Harris Health has they provide care to everyone in Harris County. So they have, I think it's like 5 same-day clinics, 18 community health centers, and 5 school-based clinics. They also have a dental center, dialysis center, and mobile health units. I'm sure, I know, as Joy said, all of these links will be available afterwards on the pages. So Hope Clinic, Dr. Caracostis just talked to us about the Hope Clinic. So I want everyone to go check that out when you see the link. The medicineassistancetool.org, that is in case you don't have money for your medicines. And a lot of people have experienced that. I see it all the time in peer support. Please go check that out. Community Partner Program with Texas HHSC. The Community Partner Program actually helps people with filling out their applications online with Texas Health and Human Services so that they can receive state benefits if they do not have the money for it. For example, Core Initiative, my nonprofit, is actually a Texas community partner, and we help people the elderly who don't like the computers or people who just don't understand the technology. We will do it for you with you sitting in front of us. So please go to that website when it's posted to check it out. The Health and Human Services Commission, if you're okay on the computers, you can access these applications online and fill them out online. It's quicker than going to an office and doing it. They will receive your application ASAP. The SNAP online purchasing program. During COVID-19, a lot of people had problems. Well, not really problems, but just have reservations about going to the store because of exposure. So now they have a pilot program that you can take your SNAP food benefits card, AKA the Lone Star card, and you can purchase your food online. You don't have to go to the store. They've done that for us during the pandemic. Fresh food locations. A lot of people have a issue with getting fresh foods, right? We have a lot of food deserts in Houston, Texas. And so there are locations where you can go get these fresh foods for free. Please check out that link. It gives you all the locations all over Houston, in every area, in every community where you can get fresh food for free. And last but not least, the food pantries that are located in Houston, Texas. There is a link that can give you the location for all food pantries in Houston if you do not have the money. Folks, do not be afraid or too prideful to go and get food, especially if you're dealing with diabetes. You have to eat. You have to eat. So please go check out all of those programs. For that list, you can access the MyDiabetesHQ Facebook page after this episode.
Okay, excellent.
Wow, thank you.
That was great. That was like a amazing summary. Like, do all this and you've got it. You know, it definitely gives people hope in terms of if they've ever had questions, you know, concerning, because I think everyone has. I think everyone has had questions to, you know, how much should I exercise? You know, I don't have access to an exercise program. I'm looking for a place. I don't have a lot of access to food. Perhaps people have lost their jobs or been furloughed or things like that. And so pivoting just slightly. So we've got those resources. I actually went online to find out for myself how easy it would be to find an FQHC in my community. So if you give me just a second, I'm going to share my screen. I'm going to Google exactly what I did, and it like literally takes 3 seconds. So give me just 1 second. Work with me here. I'm going to pop this up.
While you do that, I'll just say one word, and it is that it's really, really important that you find a doctor that is in your community, it's convenient to you. That people have to create relationships with their providers, try to stick with one provider that they like, because it's important to have a whole picture of your health, be able to follow your improvement or decline, and be able to work with you. And so for physicians, there's nothing more exciting and satisfactory than be able to follow our patients and see improvements in you. So thank you, Joy.
Okay, can you all see my screen?
Yes.
Okay, so you can just type into the browser, find an FQHC, okay? Just like that, and then hit enter. And this will come up here where it says find. We'll go to this one here. Okay, whoops, actually go back. That's not the one that I want you to see. And it takes you to fqhc.org. Find an FQHC. And you scroll down just a tiny bit here, and you can see healthcare or health center locator tool. You click on that. And it will give you the option of how far, how far you can. I just do about 20 miles because here in Houston, you have, you can drive for an hour and a half and still be in Houston.
Yes, so, definitely.
Yeah. So I'm just clicking here. And this is the part that's really, sorry, my internet is a little bit slow. So it normally just goes as fast as lightning. But here's the really amazing thing about this time during COVID and how quickly I think your FQHCs, your clinicians, your people, we are actually super resilient, I think, and our ability to take a situation and adjust is really great. So if you look at this site now here where it says click to show centers with COVID testing available, you can click on that and you'll actually see, it'll filter everything so that you can see where they're located, the address, their telephone number, and also the availability of COVID testing, which is just super.
Yeah, that's great.
Yeah. So I think that using that tool across the country, you know, as Dr. Caracostis was saying, there are FQHCs across the country, y'all. So type in your area code, get there, get the phone number, get in, establish your medical home and really grab a hold of this diabetes and have control over it, and have control over the management of it. Yeah.
You know, Joy, that's a great point because oftentimes I'll talk to patients that are hospitalized who do have diabetes for quite a while. And, you know, unfortunately, one of the things that brings them often in is out of control, you know, blood glucose. And it will often be because they have not seen their doctor or their outpatient healthcare providers in a long time. They sometimes just forget or have other barriers, as we've been discussing. And so I can't, again, continue to agree, you know, with everything that's been said here today about the importance of establishing that medical home and getting in and seeing your healthcare practitioners, you know, regularly.
Yeah.
Definitely.
Awesome. So we have something very special. So in addition to providing excellent care, to providing, you know, my family isn't from the States, so culturally appropriate care is something that, you know, people really are looking for, in addition to like handouts in their own languages. But this is something really cool that Dr. Caracostis and crew has come up with. Would you like to tell us a little bit about the Bite of Hope that takes you into your food? We've had some comments posted asking questions about food and eating. Can you share with us a little bit about Bite of Hope?
So Bite of Hope is for the lack of a better word, a culinary institute. So what we're trying to accomplish is we're trying to change how the philosophy of eating in our community. So you can probably, you know, the one thing you're missing right now during COVID is eating out. You know, there's not that many restaurants out there, and so a lot of restaurants have closed. And there are not enough tables, and you're probably missing your takeout. Or so one of the things people do a lot and is purchase food, and the food that you usually purchase from restaurants is high in carbohydrates and saturated fats because it's tasty and cheaper to cook. And what we want to really transform the way restaurants think about food and empower them to change their menus and their diets to make a bigger impact in their communities and use this as a food for prescription program as well, so that not only are the restaurants changing their diets, but the doctors are actually prescribing these new diets in a prescription path to empower the patients to eat in a healthier way, and also hopefully be a catalyst in the economic development of our communities. Because as you very well know, we're only as healthy as our pocketbooks can afford us, right? So if we have more money, we eat Whole Foods and finer, better restaurants. And if we have less money, we end up eating more McDonald's. And I think that really empowering economic development in our communities and helping businesses thrive through healthy options is a vision that we have created. We have been on the program almost for a year now, and we have a chef on board. So we may be one of the only FQHCs in the country that has a chef on their staff. And the chef works with our medical team, our nutritionists, in educating them about healthy options for their patients, as well as with the community. And so during COVID, we launched a program and to help restaurants that were closed to revise their menus and educate them about how to make healthier food without having to lose the affordability and the profit margin, and help them with marketing themselves as healthy food options so that they can target and increase their market share. Really, it's a model of upstream thinking and not just thinking about the care that we provide within our four walls, but outside our clinical expertise.
Wow,
Yeah,
that's really amazing.
It is. And my dietitian heart super loves that. So, and just the consistency in messaging that I think is really important. So not just, your doctor saying you should be eating this way, and not just take away all of these foods that you've ever liked situation. Your physician prescribes it. Your dietitian goes over it and personalizes it. You head out to Bite of Hope and you see someone preparing it in that way. It's just this continuous education that builds and builds and builds on one another. And I think that's just thinking outside of the box and bringing options and working with the community from within the clinic. I mean, I think that's just fabulous. Thank you so much for what you do.
I think what's really amazing is that during this downtime when the restaurants maybe weren't opened for that time, but to take that opportunity and usually and use it as an opportunity to learn more about, how to prepare maybe the same recipes, but more healthy, and then still be able to have a profit margin. So it's like a win-win. And we took a time where it should have been, a dark time and brightened it. So I think that's amazing.
Right. And I think as far as the people, from hearing from the people, their biggest complaint is, well, I like going out to restaurants. You're going to tell me I can't eat restaurant food anymore? But now this gives them a chance to go out and still eat healthy foods, because the chefs are cooking the food now, and they can still go out, have the whole restaurant experience, and they don't have to lack that social component to actually dealing with a chronic illness, because dealing with a chronic illness, it has so many impacts. Is not even funny, and socially it makes you want to cut yourself off, but providing these things actually helps them to still be able to go live life and say, hey, I can still go to the restaurant, I can still eat healthy. So yeah, I hear that a lot in peer support, and so that is wonderful. I love it.
Well, if you want to watch our recipes and meet our chef, we have a YouTube channel, Bite of Hope, and you can we have a child champion there that cooks with the chef and encourages children to really get involved with healthy foods. And you can go to the YouTube and watch some of the recipes if you want to try some salads and stuffed eggplant, stuffed bell peppers recently, as well as vegetarian lasagna, all very delicious. So try look at the recipes there and give us our feedback. And also send us your recipes. Why not?
So that you can change them. Are they a type of like chiles rellenos? Is that what it's like? Like your stuffed bell peppers?
That's right. Like the stuffed bell peppers, we just put that out, and it's very easy. It's very healthy, you know, and it's very delicious. So try it out.
Awesome.
Great.
We'll definitely put those into our resources as well as a place to go, because, you know, everybody talks about food and components of eating. And I think when I was young, one of the things that made me want to become a diabetes educator and a dietitian was my parents went, you know, to a dietitian, and they were asking about foods that are culturally relevant in the Caribbean and Latin America. And I remember my mom saying something along the lines of like, comida sin sabor. And that means like food without flavor. And that is not true. As a person living with diabetes, you can eat foods from your area of the world, from your culture. Slight adjustments and modifications can totally be had. And I think that having an opportunity to do that in a space that has, you know, food as medicine, as a model, as a theme, as a philosophy, that's magic. It really is. Yeah.
And I think Serena brought up a great point too, in that we don't only eat for needing to eat for staying alive, but we also eat for the experience and for wanting to, you know, be in camaraderie with our family and our friends. And then another benefit of, you know, eating at a healthy place is because even our family members or friends who don't have maybe a medical condition and think they can eat anything and everything, they learn that they too should be making healthy choices.
Mm-hmm. And I like that one of the aspects of Bite of Hope is to empower and to spread the word about healthy eating throughout the fabric of life. So
Right.
kids are powerful, okay? If you have kids, you know that they will tell you things. I mean, my son will say things like, Mama, you didn't give me enough broccoli today. I mean, I'm like, it's coming, it's on the stove, you know? And so I think that the magic of having that type of situation where you have a family-based clinic, everyone's taking care of you holistically. The kids get the same messaging. They remind the parents and keep the parents on task. And then the community says the same thing. It's just, it's something that really shapes how you see and experience diabetes in a way that is not just pure survival. Like, I gotta make it with this disease, but it's, I can make it with this disease and I can thrive with this disease.
Right.
Super important. Mm-hmm. So along the theme of preparing to choose your medical home and preparing for visits, you know, we want people to feel like they're in the driver's seat. So if you ladies if you can tell us from your perspective, the very importance of having a medical home, because I think each of you play a very significant role on a person's diabetes management team. And we already understand for ourselves where we intersect, you know, where our web kind of meets and comes together. Can you expand upon that for someone living with diabetes or a caregiver? Can you explain to them how your piece fits into management and then how that comes together? I know that's like a lot of pressure, but go. We can start.
Well, I'll go and I'll just talk about, I call it the cradle of care. Yeah. And I talk about it in that it's a continuum. And so, for example, someone comes into the hospital and let's say they're newly diagnosed. And then I, you know, want to talk to them about what they're going to do when they go home. And I think one of the unknown healthcare team members, at least in a hospital setting, are our social workers and our case management department. And a lot of people don't know what that is. And so just to explain that, if you're in the hospital a member of your healthcare team would be most likely a nurse, and they're called care managers or case management. And they're going to be looking at the whole picture, and they're going to be starting to look at your discharge planning. If you identify to them or to other members of your healthcare team that you think you're going to have some difficulty when you are discharged with this new diagnosis of diabetes, for, finding a doctor, finding a medical home, then those are the people that you would request to talk to, the social worker or the case management nurse in the hospital. And so for my piece, that's the most important, is that's that part of the continuum of care. And then that handoff would be that they would be, getting in contact with like Serena's peer support group, and also making appointments at a place like the Hope Clinic or other physician offices. So I will let Dr. Caracostis and Serena continue.
Yeah, if you ladies can just wrap us up. Same question.
Yeah, I'll say from my part that healthcare is about relationships, and we want to have relationships with our patients. We want to know why they develop diabetes, how we can help them to manage it, and diabetes is not a one-time event and say, hey, you're diagnosed now, you need to check your sugar and do your diet. It is an up and down. There's so many stressors, so many changes in life. And if you don't, it's uttermost important that you have a relationship with your doctor, that you can call them and tell him, hey, tomorrow my sister is getting married. There's going to be cake. I'm super stressed about it. And work with your physician so that you can manage that event, that one event. And it's very simple, but then it can be a huge trigger for hospitalization. And these relationships are cultivated and done over many years. We have patients that have been with us for 10, 15 years, and they've been managed their sugar very, very consistently. And we've been able to take them through hard times and enjoy lighter days. So I think that relationships with a person that you can call and that can answer your questions takes time, and I encourage you to invest in them. And it's an investment from both parts, from the part of the physician and from the part of the patient. And like any relationship, it has its good days and its bad days. The bad days when your prescription is not filled in time, or in the good days when you get your service in in less than half an hour. So please take the time to have a relationship with your doctor.
Okay, my turn. Okay, so I always tell people it is very important to have a primary care physician. When you're dealing with diabetes, it's more than just primary care physician, because there are other specialties that you need. A cardiologist dealing with your heart, an endocrinologist is very important. It helps you. They're really specialized in the endocrine system, where diabetes most affects. So you have the podiatrist, you have the dentist, there's a whole list of healthcare professionals that you need to access. Now, I know a lot of people come to me about how they don't feel comfortable talking to their doctors. This is a real concern for people today. And everybody's not going to feel comfortable. I help people with that, with peer support. I help people with the little questions that they might not want to tell their doctor. I'm not feeling well today. I'm stressed out. Someone died in my family. I'm grieving. Things like that. You really do need help with that, because as we mentioned all the time, stress is really bad on the diabetes. Yes, I see the slide. Please go and check out our Diabetes Peer Support Network. We are on Facebook. All you have to do is go to the search engine, type in Houston Diabetes Peer Support Program on Facebook, and it will lead you directly there. All you have to do is click on request an invite, or just a request to be on the page, and our admins will accept you there. We talk about everything, folks, and I will always tell you, go to your doctors, go to your doctors, go to your doctors. They're very important, even more important than I am. So there you go.
Serena, you are super important, not more. No member of the team is is not important. You provide care for individuals, on the real, in the trenches. I think we all do. I just think it's so wonderful that you all could be here this morning and that you took the time out. And I know that you're passionate, obviously, because I've worked with all of you. But I think it's important for our viewers to understand too, that there are people everywhere who want to help you manage your diabetes. We want to be there on your team. We want to be your cheerleaders, and there are networks that we create. And then also to remind clinicians that you don't have to do this on your own. Reach out to communities, reach out to your FQHCs, especially if you're in the hospital or you're in an outpatient clinic and you see that there's a need. You can do referrals to clinics like the Hope Clinic. And I have two. I've sent my patients there after their high-risk pregnancy. It's become their medical home. And then I see them, at a following high-risk pregnancy later, and they've had amazing care in the interim. And that you cannot put a price on at all, that level of security and comfort from someone. So do you all have anything? Well, actually, anyone who has any questions or comments, please put them in the comments below. We will all try to get to them within the week to answer your questions that may come through as we're coming down to the final minutes here. It feels like we haven't, it feels like we could talk about so much more. But we want to respect people's time. Thank you all for coming on board this Saturday morning, viewers and guests. You make me so proud. Thank you.
Thank you.
So another brilliant conversation, everyone, with our amazing guest speakers. A huge thank you to all you viewers out there. Please mark your calendars. This is a reminder that we will still be broadcasting every Saturday at 10 a.m. Central Time, 11 a.m. Eastern. We apologize for our technical difficulties this morning. Technology, some days you want to hug it and cheer it on, and some days you're just grr. So our next episode will air next Saturday, June 27th, and will feature Dr. Stephen Linder, professor at UT School of Public Health, and Reverend Canon Tone Smythe, of the Episcopal Diocese of Pennsylvania. We will be talking about why place matters, why your neighborhood, why your health begins inside of your neighborhood. Thanks again to everyone. Please, please, please comment. And don't forget that any of the content here is not intended to replace the discussions, the links, the important messages and decisions made by you and your medical team. We always want you to check in with your clinician and make sure that medications, exercise, all the planning around your management is personalized specifically for you. Thank you, everyone.